Hey, it's Dr. Birchler here, and wanted to show you a couple things on vehicle accidents today. Go ahead and watch this. Ugh. Don't know what speed that's at, maybe 40 miles an hour or something like that. But the reason I show this is you can kind of see what happens to the person's body in a case of a vehicle crash. And this is just this is a kind of your typical rear end collision. Somebody going maybe 30, 40 miles an hour, doesn't slow down for whatever reason, maybe icy roads, things are icy, they hit the brakes and they just slide and they hit another object. And that's not even somebody coming towards them. The head-on collisions are certainly much more force than that. I had a couple cases this week that just brought some things to mind. And when I deal with people, I find that a lot of times they just have some unknowns about both the legal side of how insurance works, and then also just the clinical side of, like, I see people feel what I believe are mistakes in terms of getting themselves checked out or not checked out, and going to the ER and told, hey, you're okay, which basically just means nothing broken. So I just want to go through a few things to help understand what's the best thing to do when you're in a crash scenario. My advice is, even if you're in a minor car accident, 5 to 12 miles an hour, 5 to 15 miles an hour, get yourself checked by a chiropractor. You might or might not have a significant injury, but let me show you something here. Accidents, even at a slow rate of speed, even in, say, 7, 8, 10 miles an hour, can cause some significant whiplash type of trauma. The way car bumpers are designed, they're designed to recoil and keep their shape at 10 miles or less, and in fact crash tests show that they actually do that up closer to like 15 or 20 miles an hour. Now, it can seem like that's good for the car insurance companies, because every little bump, they don't have to like replace a bumper because it's dented. The problem is when that bumper is like a rubber rebound, all of that force goes into the occupant instead of being absorbed by crushing the bumper. That would actually be better at a low speed of collision for the occupant. So you have this kind of like elastic recoil thing that happens to a person's spine even at a low speed, and whereas the bumper may crush around 15, 20 miles an hour and actually take more of the shock and actually cause less damage to the person than something at, say, 8 or 10 miles an hour, right? So that's one factor. I had a couple cases this week, one in which a gentleman was rear-ended by a drunk driver at about 35 miles an hour, not real dissimilar to the video I just showed you. And of course, he was stiff afterwards, and then over the last couple weeks, his back has started hurting more, and he's in a relatively common scenario, which is, hey, I was in this crash and I kind of felt it. I thought it would maybe go away, but it's still lingering. I'm not sure if it's from the crash or that kind of thing. You fast forward that scenario, what I've seen many, many times is you're a month, 2, 3, 4, 5, 6 months, even a year down the road, and instead of things getting better, you're actually worse, or you're having things show up that you didn't expect. Having headaches I've never had before, my arms going numb I never had before, I have this weird numbness or tingling in my leg, or my hip really hurts. And at that point, some people don't even connect it back to something that happened months ago. And then sometimes they wait a year or so, and it's like, well, it was caused from the car crash. Can you still get yourself taken care of for that, even if it's been a year or so, as far as the insurance goes? The way Pennsylvania state law works is, if it's actually from the crash and you report that, you basically have 18 months. If it's any more than that, there's no way you're going to get that covered. It can still be hard to get it if it's been several months or a year or more, but the state law basically says, hey, if that's actually from the crash, it's medically necessary, it's reported in less than 18 months, you can get the treatment for that covered under your insurance. Also, point of note here, Pennsylvania auto insurance, if you have car insurance, even if you're in somebody else's car, even if it's your fault, other person's fault, doesn't really matter. You have a minimum of $5,000 of medical coverage for any accident that occurs in a vehicle. Use of that medical benefit cannot make your insurance rates go up. So some people get worried that the insurance is going to raise their fees. That can happen for if you're a bad driver and damage to the car, but the insurance companies can't raise your rates because of a medical claim. That's a separate thing. That's state law. All right. So just understand, Pennsylvania is a no-fault state. So whether or not your fault or somebody else at fault, as long as you have insurance, car insurance, you are covered at least for state minimum, maybe more than that, depending on your insurance policy. So some of the reasons that people don't get themselves taken care of is they're worried about their insurance rates going up. They're worried about, is it going to cost something? They don't understand the no-fault concept, whether it's their fault. Well, since it was my fault, if I report that, then I'm going to have to pay for that or something like that. That's not how Pennsylvania works. Commonly, people will go to the hospital and they'll have something done, checking for brain trauma, and they'll be told basically they're okay. What that means is your brain's not bleeding. It doesn't mean you're okay necessarily. It just means that you don't have a broken bone or your brain's not bleeding or swollen or something like that. Those assessments are routinely not checking the spine and certainly not checking it from a standpoint of function like chiropractic does. They're really just checking for dislocation or fracture. So chiropractic is really the profession that is the best to check your spine for problems after a vehicle crash. These other things are more designed for severe trauma that would necessitate a surgery or something like that, right? So one other factor is this little chart here is from I call it the Bible of whiplash treatment, but there are 5 grades of severity of whiplash trauma, and these are recognized categories. So the most minimal grade would be you don't really have many symptoms. There's no limited motion. There's no ligament injury. Maybe you just have some stiffness or something like that, or you feel a little bit not right. Even that grade 1, the recommended clinical guidelines for treating that would be maybe 10 weeks or so, maybe up to 20 visits to a chiropractor, just to help the spine as it's healing, for the soft tissue to heal correctly, so there's not loss of alignment, loss of mobility, things that would then lead to arthritis and permanent damage. So it's not necessarily about the pain treatment. It's about the treating of the problem, so that as it's healing, which your body does on its own, the doctor doesn't do that for you, your body's going to heal, but it can heal crooked, it can heal stiff, it can heal misaligned, and all things that would lead to problems down the road. So even in the most minimal cases, you want to get checked out, get the mobility checked, and make sure that the problem is addressed as it's healing. And of course, then you have things where a person doesn't have much pain. They'll often report, I feel a little bit stiff. They may not recognize the loss of motion that's there, but when we actually measure that, you can pick up asymmetries and things, especially if you have had those measurements previously done at a chiropractor and you have something to compare to. You say, hey, it's actually different than it was before, and that you have an objective finding that certainly needs to be treated until it's at pre-accident status or as close to that as you can get with the treatment. I'm going to show you one more thing, and this is a patient came in earlier in the week, a teenage girl in this case, and when she was just a kid, she was in a vehicle that flipped and rolled. And like many cases, it's amazing what can happen, and then you go through and it's like you're still alive, and maybe even no bones broken, and you generally get the idea that, yeah, I was kind of sore from that, and then I got better, and like you're okay. One of the reasons I always recommend getting things checked out is this family was unaware, but when we took x-rays of the spine and added flexion injuries into that, which are taken to assess for ligament damage, which is permanent, not correctable, it's a permanent impairment in the medical legal literature. I think they were unaware of this, but this young gal has a instability in her spine that would be rated as approximately 18 to maybe up to 28% whole body permanent impairment. And this is the kind of thing, if somebody else caused that accident, if you don't take x-rays, if you just go, it just hurt a little bit, maybe it'll go away, and then you feel better, and you think, well, no big deal. This is something that may be a six-figure digit award in terms of the legal aspect of that compensation for that level of injury. It's a permanent whole body impairment in the medical legal literature. So some reasons to get some things checked and looked at regardless of the level of pain. Understanding that in this case that gal might have been 7 or 8 years old, and little kids have bigger heads relative to their bodies, and so they're going to have higher G-forces that can really damage the spine. So the tricky part with kids is that they will often not report much pain in comparison to adults, and yet the G-forces going through their spine may be higher, and they may have more of a higher mechanism of injury based on that, just their body morphology at that age, right? So just want to show some of these things that have come up in the last week, and understand if you're in a car crash, even mild, get yourself checked by a chiropractor. That way you can get good advice on your health, and also depending on the situation of who's at fault and all these kind of things, whether you need to seek some legal advice for your situation as well. If you have any questions on this or personal situations, respond to this video or message us or call here, and we will help you out. Thanks for watching. Hope this helps.